Hi friends, it's Veronica Vax, naturopathic physician, happily retired. Let's talk about esophageal cancer today. So let's start with the clinical case. A client of mine contacted first time to me, and the first question out of his mouth was, do I have esophageal cancer? Let's look at his clinical case. It's 38 years old male. He had acid reflux for about 9 months. 6 months ago, he had a first gastroscopy, and results of the gastroscopy is mild inflammation in the lower esophagus. So acid reflux confirmed. Gastroenterologist prescribed PPI, and patient went to take them. Unfortunately, it did not work well for him because he developed gas, bloating, and started to have more acid reflux. So he tried to decrease the intake of PPIs, and has a difficult time to discontinue the medication. And for the last 4 weeks, he turned for the worse. He has started to have difficulty swallowing solid food and more painful acid reflux. So he called his gastroenterologist, and gastroenterologist said, continue with PPIs, and I will see you in 8 months for next gastroscopy. Patient is going absolutely out of his mind. So let's talk about esophageal cancer. How long it takes to develop? Barrett's esophagus, early symptoms of cancer, and then other symptoms that show up later in the process. It takes about 10 to 20 years to develop esophageal cancer. And you may ask me, why is that the spread is so wide? And the answer is, it depends on the symptoms. Some person may have it, acid reflux only for 2 or 3 hours after the large meal. Some person will have it at night only. The other person will have it 24 times 7 times 365. And that person will have a higher chance to develop earlier cancer. Also, risk factors such as smoking, alcohol consumption, and family history may contribute. Barrett's esophagus is when normal squamous epithelial cells of esophagus get replaced by columnar epithelial cells, and it takes about 5+ years. Again, severity of the symptoms and risk factors may contribute. The earliest symptoms, as the person noticed, difficulties of swallowing solid food start to show up. And as you can see on this picture, the narrowing of the esophagus becomes more narrow. As a result, solid food will have a difficult time to go through that. Also, GERD becomes worse. Then other symptoms as disease progresses start to show up. So more acid reflux, trouble in swallowing of solid food, then semi-solid, and then liquid food. This is essential to understand. There is that precise progression, and there is no waxing and waning how some patients will describe, oh, I sometimes I have a difficulty to swallow, sometimes I don't. I had it 6 months ago, I don't have it now. Maybe I do, maybe I don't know. It goes, I started to have a difficulty to swallow. Then it gets worse. Then I started to put more water in my mouth to make the food semi-liquid. So that was okay for a while, and then it gets worse. And now all that I can do is to swallow liquid food. Then the next symptom comes up as a weight loss, and then also developing hoarseness, scratch of voice, and cough becomes persistent. And by the way, if you need a health coach, contact me on my website. And now let's go for the explanation to a blackboard. Oops. I already pre-drew for us picture of the digestive tract. This is the mouth with the teeth, esophagus with low esophageal sphincter. Esophagus is lined by squamous epithelial cells, and they look nice and square. They have also nucleus here. As insult starts to esophagus, these epithelial cells, they don't like it. So they start to change their size and they kind of shrink. So when you go to gastroenterologist for gastroscopy, those cells look different. So he takes biopsy, and they may look actually round. They may start to change their size and form. So they look like that. And it's the results of biopsy will be inflammation. As insult continues, the cells actually may change even further. Let me just show the other picture. Let's draw it bigger like that. So this is our part of esophagus. So instead of being nice and square like that, cells may become different size and different form. So they may, and one other cells may start to grow. But when biopsy is done, pathologist will look at those cells and he will say, yes, it's still epithelial squamous cells from esophagus. But and it's called, in medical terminology, it's called dysplasia. But then the cells may totally change, and other cells may populate that. You understand that the stomach has a different types of the cells that lining here the stomach, and they have a different epithelial cells that have a different purpose. They produce a lot of mucus. Okay, and those cells may start to crawl up here and start to populate the esophagus. As a result, instead of being nice and squamous epithelial cells, they look totally different. They some of them could be still epithelial cells, but the more cells from different part of the digestive tract to start to show up. When that happens, that's what exactly called Barrett's esophagus. So it's substitution, one type of the cells with another. And it's all seen only on biopsy. Because the cells are different, and also the insult from hydrochloric acid continues to be affecting esophagus. Besides those cells, there are muscle cells that get damaged too. And the purpose of the muscle cells stretch the esophagus and make food to go through. So because they get damaged, esophagus cannot stretch in different directions. As a result, when the food comes in, two factors contribute to difficulties of the swallowing food. Number one is the narrowing of actually becomes smaller. The second factor, that muscular cells become damaged and they cannot stretch in different directions because of the damage. Now, at the same time, there are blood vessels that go here, and if these pathological cells will start to grow into the blood vessels, then we will start to see a bleeding in this particular person. And that's already cancer, right? And if things progress in the same direction, then the next step you will see is a weight loss. And the weight loss can be due to two factors. Number one, because of the narrowing of the esophagus, person cannot swallow the food well. As a result, he may switch to drinking more water, drinking juices, and not getting enough just plain nutrients. He just cannot eat. That's the one point. The second point is, as the cancer starts to grow here, it becomes bigger in all directions. Cancer needs more nutrients. And it's consumed all the nutrients that person eats. Cancer cells need more sugar, more vitamins, more minerals, and instead at the end, and they start to produce so-called tumor necrotic factor, which actually will deprive the person of all nutrients and redirect all the nutrients here into the cancer cells so they can grow bigger and faster. Now, I want to make sure that you understand the concept. Why gastroenterologist in this particular case with this person was not concerned and was not in a hurry to schedule gastroscopy. And I was not upset very much too, because as a physicians, we understand there is a difficulty swallowing and there is a difficulty swallowing. In this particular case, the person had a severe inflammation, and the inflammation lasted for 2 or 3 weeks. What happened when there is an inflammation, there is a lot of fluid goes into that. As a result, the pipe gets inflamed and it becomes narrow. And that's the result. The person cannot swallow the solid food. In cancer, it's a different factors. In cancer, the pipe could be as big as it is, but the tumor starts to grow, and the tumor is blocking the food going down into the stomach. So for this particular person, the answer is, well, let's try to find the solution for your acid reflux. Identify the cause, and then let's start to treat the cause. And then inflammation then will subside and person will get better. Okay, guys, that's it for today. Thank you very much. Ask me questions, like, subscribe, all necessary links below. Bye-bye for now.